Hi, my name is Dr. Dumi, board certified endocrinologist. We will talk about thyroid disorder today. You remain symptomatic when your thyroid levels are normal is today's topic. So I have fair share of thyroid patients in my practice who come to see me to seek relief. They do have various symptoms from weight gain, fatigue, brain fog, dry skin, heat intolerance, cold intolerance, constipation, GI symptoms, other GI symptoms, bloating, joint pain, pretty much top to bottom. They do complain of various symptoms, yet their TSH is completely normal. Their TSH is between zero point 0.5 and 2, and they are told that they really have nothing else they can do for the patients. So then they seek second opinion and they come see me. And basically, I am very holistic in approach, and so I don't think that really focusing on thyroid health is going to solve their problem. So usually what I do is I do look at 4 pillars of health, which includes good sleep, good nutrition, exercise, routine exercise, regular exercise, and social stressors. So if those are good, then really we are going to delve into thyroid. But if those are not in place, I really focus on getting those in place first, because unless those are in place, no matter what I do for the patients, they're going to feel great. So that is number one: sleep, nutrition, exercise, and social stress. So after that's done, I look at their levels, and if their TSH is high, I sometimes increase the dosage. If TSH is really low, then I decrease the dosage. As I told you in the previous segments, TSH runs opposite to your thyroid hormone value. So high TSH means that you are low on thyroid, and if you're low on TSH, then means you're high on thyroid. Like all the other hormones, too low nor too high is going to give you good symptoms. So you have to be in perfect balance. You can't be low, you can't be high. High level of thyroid will give you a lot of fatigue because your sleep is not restful. So I look at that, but if their levels are completely normal and they're on levothyroxine alone therapy, usually I do try out adding a little bit of cytomel. So adding cytomel, which is T3, which your normal thyroid gland does produce. But if you're taking only levothyroxine, it's sometimes helpful to add a little bit of liothyronine. However, dose conversion is important, and so you need to calculate the dosage correctly in order not to get over replaced. Recent meta-analysis show that combination therapy is associated with better cardiovascular outcome and dementia outcome. So that was a welcome news because I would do this routinely. And patients oftentimes get significant relief, but about 25% of patients who will say they do not feel any different. About 25% of the patients say they feel actually worse. Cytomel is active thyroid hormone. Sometimes it can trigger palpitations and anxiety symptoms and insomnia. So you have to be very careful with that. But about half of the patients do come back and they say it was life changing. So all I did was adding a little bit of cytomel to their regimen, and their thyroid levels are perfectly normal. They stay normal or they correct because I calculate the dosage correctly. So you don't want to be over replaced. You don't want to be under replaced. And if your TSH is normal and you feel still symptomatic, then you should consider doing combination therapy with your primary care physician or other physician. And if they're not comfortable in doing so, you should seek endocrine care. Thank you very much. And